and then we'll go ahead and get started. So if you weren't on earlier, I mentioned earlier, my name is Sam Tennant, project coordinator here at CARES. I have two of my coworkers here with me. I'll let them introduce themselves.
I'm Melissa DiBartolomeo.
And Chris Barnett, CARES.
Yeah, so today we're just going to do a quick walkthrough of the Explore Tennessee Health website. I went ahead and wrote out some goals just so you guys can kind of see where we're heading with this. So we'll go ahead and we'll talk about what this is, what it's about, the partnership and the data. We're going to do a walkthrough of the three main report types on the site. We'll do a walkthrough of the map room, and then at the end we'll have time for questions, and then we'll hone in on any particular topics or areas you guys want to see. The demo itself will probably take about 30 minutes to 40 minutes, so that leaves some time for questions, and then if we get out early, we get out early. But can everyone see the screen okay? Is the share working?
Yes. Yes.
Yep.
Okay.
Good.
Yep. Awesome. So I'll go ahead and get started. So here on this front page here, as you can see, Explore Tennessee Health, our main goal with this site was targeted at that bottom there. You see where it says, where we live has a huge impact on our health. By examining targeted health data specific to a particular county or zip code, we are able to identify issues and take action to help create and sustain a healthier Tennessee. So this site was a partnership between the Tennessee Health Association and the Hospital Industry Data Institute, as well as the county health rankings and roadmaps. There's a lot more information about that partnership and the specific data in the About section up here on the right. But while I'm here in the legend, you can see this top navigation bar is going to be your main source to the site's elements. So hold on one second.
This is Melissa. I'm going to rudely jump in real quick and just let you all know that this site goes live on Friday. So if you try to access this site right now, you will get a password lock. So stay tuned. Friday, December 20th, we will go live with this site.
Yeah.
But if folks want to follow along, we should go ahead and chat out the site password.
Yeah, I'll go ahead and send that real quick, just in case you want to follow along with it.
Yeah.
I'll open the chat.
Thanks for letting me know.
Yeah. So it's GN Health Brian?
Yes.
All right, so in the chat is the password if you want to enter the site and follow along, but just note that there will be changes made in the next couple days to what you see, and there isn't 100% final. There's kind of a lot in the works between that, but keep that in mind. So I'll go ahead and keep moving. So like I said, we have our report section, our map room, our frequently asked questions, our about, and then we'll get more into the login and register as we start to get more into the reports. But as we scroll down here, you'll see we have a snapshot of the spotlight on Zip Health. This isn't the full report, but as you can see, you can jump to it down here in the bottom. So the goal with this is, so Explore Tennessee Health is designed to help stakeholders assess the health of their communities. And this tool allows visitors to explore hyperlocal health data to better understand the factors that can influence health outcomes. So within this snapshot, the default county it's going to pick is Davidson County, but you can also change that at any time down here in the drop-down menu, or you can just click all over the map, and you can kind of see the information changing at the bottom. We have our highlighted county level issues, and the order of these is being changed. That was discussed yesterday, but you can see here on the right that the top three ranked zip codes will be here and the bottom ranked zip codes, but in the full report it'll go down to 5, and we'll jump right into that as I move down. But this is another way you can get to the 3 different report types. So we have our County and Zip Health Explorer, our Tennessee Health Atlas, and then what I just showed you, the spotlight on Zip Health, which we'll go ahead and start there. So basically with the spotlight on Zip Health, it identifies the most and least healthy zip codes within different counties in Tennessee. Once again, Davidson is the first one that's populated. You can pick whichever ones you'd like. There's a couple good examples within Davidson, so I'm going to go ahead and continue with that. This I button here at the top, if you click it, takes you straight down to the About section at the bottom, so you can learn a little bit more about the curation of the spotlight on Zip Health. But this is going to be specific to county. So we have our county health ranking subdomains for Davidson County. and then their rank, number 1 being best out of 95. So the health factor, health outcomes rank is ranked 7 out of 95 in Davidson County, and you can see it goes down the list from least to greatest. But then that further breaks down into the zip codes. So we also have our top ranked zip codes in Davidson County, as well as the bottom ranked zip codes in Davidson County. So you can see we have our zip code numbers, the name of the actual zip code, the rank that was formed, and there's more about the methodology of the rankings that we'll get to as we jump further into the reports. But then there'll be the top health factor that was ranked that, and then the top social factor. But this is sort of a perfect picture of the microcosm between zip codes and why we're specifically narrowing in on zip codes. As you can see, within one county, you can be ranked second out of everything in one top health factor, but we're also, out of 600, but we're also close to last in another top health factor. So this sort of, the zip health spotlight sort of helps you narrow in on which health factors are ranked so that you can jump into the next reporting tool, the County and Zip Health Explorer, so we can zone in more on something like asthma and see specifically which zip codes are affecting a county to get it that score. But as we scroll up to the top, the nice thing about all these reports is you can download them as a PDF and print them for further use. But as we move forward and the site gets launched Friday, you'll notice we have this login button and the register button up here at the top. If you guys are following along, you can register later today, and I'll help facilitate that process at the end. But I'm going to go ahead and log in so you can see what changes once you're in the site. Just give me 1 second while I type this in. And once I go right back to that report I was making, you'll see my menus have changed. So I can now save my assessment. And up here at the top, there's a My Reports and Maps. So anytime if you've put in the work to build a report that you want to use later or cite it for a grant you're proposing to write, or looking at making some more actions for that area, you can save your assessment and you can access it in your My Reports and Maps later.
This is Chris Barnett. I just wanted to highlight one thing about this particular tool. As you click around on the counties here, you do see the county health rankings information and how those ranks are distributed across the state. But if you scroll down to the zip code health rankings, one of the primary purposes for putting together this site in general and this tool specifically is to highlight that diversity in rankings, and how things are quite variable within a county and how that may be masked whenever you're dealing with just county level information. So the site is intended to really bring that hyper-local information out, as you mentioned earlier, Sam.
Yes. So moving forward into the next report type, after you see the diverse rankings within each zip code, I'm going to go back to my legend at the top and then move on to the County and Zip Health Explorer. So this basically gives a review or a summary of the leading health factors and outcomes for the communities that you just located in the spotlight, or you can start from this area. So here at the county level, once again, Davidson County is sort of just the spot that's picked first, but you can pick multiple counties within this report, and you can see how they're ranked in quantiles here in the side. If you want to remove a county that you just selected, you can click these X's here. You can add from this drop down, or you can just click straight onto the map and start comparing counties that way. So from a county health factor, you can pick your indicators here at the top. We have 4 health factors, 2 health outcomes, and then the 2 combined health factors ranked in outcomes. So specifically in Davidson, we saw asthma was really high ranked, which is a health factor of physical environment. So just to show you kind of how the County and Zip Health Explorer works when zoning in on new things, you can see as I changed it from health factor behaviors, Davidson County was in the first quintile, but now when I go down to physical environment, it changes down to about the 4th. So we can see when we scroll down sort of which zip codes are bringing that ranking down when it comes to that specific indicator. So within physical environment, there's 5 different indicators here, and we're going to zone in on asthma. so we can see exactly, we have our legend here on the right, the asthma diagnosis occurring in a hospital setting per 1,000. To do additional analysis, you can go straight into the map room by clicking View Larger Map here at the bottom. But continuing down, specific to the asthma indicator, we'll have our rank for Davidson County, the Z-score, and then 65 out of 95. And then the top 5 zip codes specific to that indicator, which are bringing that rank closer to the top out of 600. And as you can see, it's 599 out of 600. So to do additional analysis further, in the Health Atlas, you can mark down these specific zip codes to kind of build your report on from there. But just so you can see what the map builder looks like just from hitting View Larger Map, this takes you straight into our map room. We're going to do a full walkthrough of this. This is just so you can kind of see, this is the count or the zip code that's bringing it the highest. So you can click on our map and you can see the zip code, the city name, which is Nashville, and then the rate of asthma per 1,000. So there's things to consider if the population of Nashville is much higher and that's what's causing the higher rate compared to other zip codes, which is also something to consider when doing further reports. So this was just, I wanted you to see how you can access the map room specific to that indicator. But like I mentioned before, you can click on multiple different counties, but when you come down to the map, it'll bring up the ones that are ranked the worst. So let me find one. Let me take Wilson off and leave Polk up there. So you can see how the map sort of divides. We have one county down here, or one zip code in Polk County that's ranked worse than Davidson, which will change the map. And you can click on that and sort of see the rankings of there, but it'll also show up here at the bottom. So we have our Nashvilles again, and then the one zip code within Polk County is going to be down there as well. And then their separation of ranks too. So here's a little bit more information at the bottom, the About the County and Zip Health Explorer as well. So I'm going to continue moving on to the Health Atlas. So this is the last report type, and this one's a little more complex. See how there's 2 different options that you can make a county indicators report or a zip code indicators report, which to sort of develop a comprehensive and customized community health needs assessment for a specific area that you can report on. I'm going to show you the difference between both, but between these 2 reports, they function the same way, this simple 3-step process of first picking your location, then picking your data indicators, and then picking your report type. Also, something that's interesting is you can search within, get full county reports or just zip code reports, or search by zip code within the county indicator report. But I'm going to go ahead and continue down the road of Davidson County so you can see what that looks like. And you can see you can also save your location. So as I move, if you're logged in, that's right. Luckily I am. So moving on to your data indicators list. You can see those same health factors from our last 2 reports are the ones you're going to be able to choose from. But on top of that, the Zip Health rankings has added census data as well as hospital discharge data. So we have our demographics and other social and economic factors. So you can do some more comparisons, like looking at the total population for, say, Nashville, to see if that's what's affecting that asthma rate to be higher. There's just more people or such like that. So you can select all indicators here at the top in this checkbox, or you can click down on these carets, which will bring down each indicator within that health factor. But as you see, as I hover over them, these I buttons sort of come to life. So you can click on these I buttons to get additional information about each indicator, sort of its data attributes. You can see it specifically on the map. And then we want you to know also exactly where you can get that source from and how it was collected. So for this sake, I'm just going to click the full indicator report so you can see what it looks like compared to the zip report I'll show you next. So as this is loading here in this bar at the bottom, you can see we have our, at any time you can go back and change your location or your data indicators, but we're in step 3 at this point. So we're going to have our location, which we've decided is Davidson County, and then each indicator as we go down. So under health rankings, the first thing that came up was the combined health factors rank. So with this data that was collected, this is the combined health factors rank, describes what influences the health, or this helps describe what influences the health of a county. The rank is based on 4 factors: the health behaviors, clinical care, physical environment, and social and economic. And each one has its rank according down here at the bottom against all the other counties. So you can also click show more details so you can get more information on the data background on how this was collected. So this was in a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. And this was with the county health rankings and roadmaps. And then I'll show you the difference between the zip code report and that data as well. But as you continue to move down this, there's always an option to click view larger map for this specific indicator. But also we have this hamburger menu here at the bottom where you can kind of jump directly to where you want to see. So you can see we can go down the different health factors, our physical environments like we were talking about earlier, social and economic, and then we also have all the demographic and census data at the bottom as well. So if you wanted to see total population, you'll get your report area, a STEM sentence which sort of explains this whole table itself. So we'll have our total population, total land area, and population density. Once again, for every indicator, you can find more about the source right there, and then click on the map. But as you scroll down, each indicator has further breakdowns within, say for total population, it can break down again into gender, and then we can break down again into total population by age groups. And these reports are interactive. You can click on them to sort of highlight what you want to see. So I suggest playing around with these when you get a chance, just to see sort of all the different ones. Some of these have dials as well, so you can benchmark against the rest of the state and the rest of the country. And then let me go back to the top. 1 second. And just like the reports, we have, you can download this as a PDF. You can share this on all the social media platforms or through email. You can print this. You can also export this into another Excel sheet so you can do further analysis. And then we have that nice save assessment document as well that will go straight into my reports and maps. But I also want to highlight the difference between the county health ranking report and the ZIP report. So I'm going to go back to the beginning so you can see the difference between those. So I'm going to hop over to the zip code indicator report and then go back to Davidson County so you could see the different type of output. Data indicators. I'm going to select all indicators again. Report. And as that populates, you can see the difference between the zip health ranking and the county health ranking. So on top of the data that was collected for the county health ranking, further analysis was taken to get it down to that zip code level, where hospital discharge data with the census data, they were able to pinpoint specifically what people were coming to the hospital for, specific to a zip code, and then they were able to do like principal component analysis on these different health factors. So for them, they combined the health outcomes of mortality and quality of life, as well as the combined health factors, behavior, clinical care, access, environment, and socioeconomic status. So that's how they get the health rankings per zip code compared to just the county, so you can dive in further. So like before, we have our zip code in the table, the zip name, the county, and then this is the health factors combined index score, and then the health factors combined rank out of 600 out of every zip code in Tennessee. And then same over here, the health outcomes combined rank compared to the health factors combined rank, which then they were able to generate the zip health rank out of 600, and that's where we get that value from. So this works the same way as the other report. It's just more of a hyper-local data. You can jump straight into a map, but as you can see, it can get pretty messy with all the zip codes. So kind of the nice thing about generating your report by picking your location, you can search by zip code here instead of county. So you can just get one or two instead of all of those that were in Davidson and move further from there. So that's sort of the 3 report types. I'm going to go ahead and jump on over to the map room unless either of you want to highlight something else as well.
Yes, this is Chris again. Just to highlight what we're showing here in this Tennessee Health Atlas is really a comparison between the county health rankings and these zip code health rankings. And there are a few characteristic differences in the 2 data sets. First off, the county health rankings does not provide a single overall ranking of your county across the state. They divide it between a health outcomes and a health behaviors ranking. And so you get the 2 different types of ranks for it. Whereas in the zip code health ranking, all the factors are combined for a single overall rank across the state. A second distinction to note is that the specific indicators chosen for the county health rankings are different and rely more upon secondary information than the specific indicators chosen for the zip health ranking, where Heidi was able to collect information directly from hospital records to help support those specific indicators. And there is a good link. I hope you show that later. The link to some of the analysis that was done by the folks at Washington University in St. Louis and Heidi talking about the comparison between the county health rankings and the zip code health rankings data. And they are somewhat in alignment in terms of their results, but very different in terms of their inputs.
Yes. All right. So yeah, to find more about that, over here in our About section, you can see about this whole page, the Tennessee Hospital Association, and then it dives deeper about the data if you want to further dive, the difference between the zip code level data. Here's a link to that previous research he was just talking about from the University of Washington. And then here's the county health rankings and roadmaps, so you can see the difference between the both and how this was curated together. But moving forward from the reports, I'm going to hop over to the map room. And I think this is a great example. Well, here's the front page. You can go straight to a fresh map with this link here and start to build your own layers from the top. But here's some perfect use cases, I think, from the 3 reports that were just generated, or the 3 different types, and sort of why would you use it, or how to move forward with it in the map room to sort of build your case. So these 3 examples right here are specific to smoking and lung cancer. And so I thought this one here on the right, what are the downstream health outcomes resulting from differences in health factors in your county? Just seeing the difference between a zip code separated by another zip code and the difference. So this example here, the rates of lung cancer diagnosed in a hospital setting reflect patterns of smoking in Lauderdale County. Rates of lung cancer range with a low of 3.8 per 1,000 residents in Henning to a high of 20.97 per 1,000 residents in Halls, which is a relative difference of 453%. But as you go into the map room, this orange line is that first 3.8, and then one zip code away from it, there's one in between, there's that 453% difference. So to dive in further, like why is lung cancer so much larger that close? Let's look at the smoking rates. So right next to it, comparing those same zip codes in Lauderdale County, a low of 65 per 1,000 residents in Henning smoke, and then a high of 165 per 1,000 residents in Halls, which is a difference of 156. So you can sort of dive in those zip codes, get that hyperlocal data, so you can start to develop intervention strategies. So I thought these were 2 perfect use cases for a map. And then they're also a good example of, you can jump straight in to see and sort of navigate. If you've never explored in the map room before, just ways to add layers and sort of navigate around there. But we're going to start from scratch here in the map room. So as that generates, you can see there's about 3 different ways here I can add data to the map. We have our browse by topic, we have our browse by source, and then we can enter a keyword. So if I want to browse by topic, we've taken a lot of those health factors and put them into different categories here, these top 4. And then as I click on these carets under demographics, you can see I can decide to show it from a county or a zip code standpoint. Since we're looking at zip codes, I'm going to go ahead and click there. And here are those data layers that sort of look really similar to that health atlas I just showed before. where I can click on the checkbox here on the left, or as I hover over, this eye comes back to life so I can get more information about the layer, which will give you a nice description, the specific release date of when this came out, when it's going to come out again, the release cycle, and then the data geographic unit, which was zip code. And then once again, you can access the source specifically and the data source description. So that's one way to add data to the map. Another way you can do that is to browse by source, which works the same way with these carets. But if you're more familiar with data or just want to see what specifically we're using and where it's coming from, so a lot of that census data will be the American Community Survey, and you can kind of hop back down these carets to get those layers back up. But sort of the main way to add data to a map is to search by keyword, which is what Google has sort of conditioned us to do. So I can type in something like poverty, and you can see I have about 14 layers that pop up here. And over here on the left, I can either sort those by best match, just by searching, or by release date. So if I wanted the most current thing that came out related to poverty, that'll populate up here at the top. So I'm going to come back to best match, and I'm going to add the population below the poverty level by county, ACS 2013 to 17. And all I have to do is click add to map down here at the bottom, and you can see that populates right here. So now that we have some data on the map, a couple ways you can move around while you're in here are these plus or minus signs over here on the left. So I can zoom out with minus, or zoom in to a hyperlocal area at any time. You can also click and drag around the map, and then this home button will take you back to its original extent at any time. So also over here on the right is our legend. We can enter a location. It can be as specific as an address, or you can just put in a zip code or a county like we did earlier. I was loving that there's a Coffee County, Tennessee, so we can put in something like that. That'll take you straight to Coffee County. And then I always like to zoom out a couple more just so I can see my highlighted area I searched for and then compare to the counties around it. So you can also click on our maps. They're interactive, and this metadata will sort of come up related to the highlighted layer. So we have our state, the county we're in, the population and poverty percent, and then our margin of error, total population, and so forth. But also something to note is this is a really good layer that has multiple geographies. So I know today we're looking at county and zip code level, but a lot of the data entered in you can also get by census tract or congressional district, school district, but I'll go ahead and click on zip code. You can see the map goes ahead and changes right away, and then you're able to click on specific zip codes to get that same information. Something else to note is you're not specific to one layer. You can add as many as you'd like. So I can type in something like median income to get median family income if I wanted to compare that versus the poverty rate. But these are two polygon layers, and I want to be able to see them both. So something you can do is hit label, and that'll pop up the label for each county, and then I can hide the transparency. That way I'm still just looking at this one population below poverty level, but as I zoom in, you can also see the median family income that's associated with that county. So now that we have a couple layers added to the map, we also have some reference maps that you can add to it, our Tennessee state boundary. You can add our zip code boundary, or water. Usually we have highways and stuff like that, not on this one. So now that we have a couple layers added to the map, we have a couple tools as well you can do for further analysis. So something you can do is query data, which is essentially searching within it. So if you want to find something specific to your area, or if I wanted to know median family income for my showed counties right here that are less than, let's see some numbers, 50,000. All the ones will populate around me that are less than 50,000. So we have our 6 counties here. And then I can also show these attributes in a table, and we can download this data for further analysis or to add to any reports moving forward. That's one tool. another thing we can do, which isn't, or we have the select data, which is if you just want to report specific locations in a specific area, all you have to do is drag that rectangle over and you'll get the zip codes you covered. Or if you wanted to know a specific radius from a specific point, like 10 miles from your hospital, you can click on your hospital point and every zip code that'll pop up within 10 miles will show there. And then also you can show your attributes and download that data as well. We have a couple more tools, not so much applicable for right now, but in agriculture economics, this measure tool, if you wanted to measure how far or how big your farm was or how far your apartment is from a bus station or a farmer's market, you can measure your distance there, which will give you the miles, feet, kilometers, and elevation as well. You can measure a whole area if you wanted to get a specific neighborhood, for instance. In that square, you'll get your acreage, your square miles, and your perimeters as well. We also have the mask tool. So if you wanted to build a report, you can do the full state. Let me go back to zoom out. So you can see the layer popped up around all the way around it. But if we wanted just Tennessee, we can mask the full state. Or we can also do just specific counties. So if you were reporting on 3 counties in your report area and you wanted, ooh, hold on. My mouse is escaping me. And you wanted to pull that for an infographic for your report as well, you can just highlight and change the transparency with that as well. So there's the mask tool. And then we also have our swipe layer. Let me go ahead and change this back so I can show you the example of the swipe. Unlabel that. There we go. And then that way you can see the difference between 2 layers. We have our population layer and our median income. So you can kind of do some analysis looking just at zip codes between 2 layers as well that way. But on top of that, just like our reports, we have a save option. You can save your report or your map. You can share it. The nice thing about this is we have a map link. So if you've taken in the time to put in the layers you want and you want to share it specifically so someone else sees the exact map you just made, you can copy this map link and send it to them. And then we also have exporting options. And then something I did want to note too, we have this help section that we will be changing specifically to Tennessee, but this is basically a walkthrough of the map room if you need any further help. But it's all the images are of Missouri right now, so that'll be fixed soon. But
just one more thing on that export option, that will help you support preparing maps for documents or presentations that you have. So you can quickly pull in a PDF file or a PNG file to support your other activities from the map room.
All right, so now that we've seen the reports and the map, we have our frequently asked questions page here, as well as the about for more information on the data. But is there any specific questions that have popped up from seeing these reports or this map room that you guys want to talk about now? We can go ahead and open this up to questions. Yeah, let me check the chat.
On the surrounding, where is that really the actual data for the state surrounding Tennessee, colored appropriately when it's in that big, and where we don't have that data is when the map's just by itself.
Yes, what Sam is showing on the
counties and see what they are outside of.
Yes, what Sam is showing on the map right now is some of the additional information that we've included in the Explore Tennessee Health Map Room. These are from secondary data sets that are usually national data sets. In this case, he's chosen 2 American community data sets. And we have chosen to display the national data to give context around Tennessee. And all of those areas are fully functional even outside of Tennessee. So Sam, if you click down on one of the zip codes outside of Tennessee, you'll see that you still get a return of a display table of the information for those zip codes outside of Tennessee as well. For the specific data developed for the Explore Tennessee Health site, both the county health rankings data and the zip health rankings data, those data sets, and you might want to load one of those, just, okay, those data sets, sure, are just for the state of Tennessee, and so you'll see those end at the Tennessee boundary, as you can see at the bottom of the map there. They do not carry on outside the state.
Thank you.
Yeah.
I know you had Baptist Memorial looking at this, but as far as like what they need for a CHNA, is that something that we can help them define, or this can help them define, or do they just need to know what they need to do and pull the right data?
Yeah, I honestly don't know the answer to that question. Matt, sounds like you've been a little bit more involved with CHNAs, maybe at hospitals in Missouri. Do you have color to that?
Sure. So there's, it's, I guess, unsurprisingly specific guidelines from the IRS on what constitutes a CHNA and, what needs to be included. So, one of the main components is the secondary data analysis component that comes, during and after engagement with your community stakeholders, and you're supposed to enlist the help of a public health expert in your area. But for example, one of the requirements on that secondary data analysis component is, an overview of the demographic characteristics of what you've defined your community or your primary service area to be. So basically, where you would go out and develop a full-blown secondary data analysis report for your community health needs assessment is right where Sam's at now, Mary Lane, in the Atlas report. And after you've gone through the hoops of engaging with your community to find out what's important to them, one thing that's helpful with this information is that you can go in and you can adjudicate, what's actually needed by the community versus what's perceived as a need. So that's where the example I like to use is, during my time on the board at the small rural community hospital that I used to live nearby, the concrete plant felt really, importantly that obesity was a big problem in the community. Well, they just wanted to build a bunch of sidewalks as part of our, as part of our community health improvement operations. So, with information like this, you can go in and look at those hyper local areas to see, okay, is the supposition from community members that obesity is a problem in our specific community actually a problem, or is it not supported by the data? Should we be focusing on something else? But if Sam went ahead and hit, convert this selection that he's got into a PDF, you could rubber stamp that and send that off to the IRS or post on your website, and it would suffice instantaneously. That's sort of what the design is for. That's not our intention. We don't want to, provide any easy button for, the community benefit folks within hospitals. We hope they put a lot more thought into it, but at the end of the day, if that's what they desire, they could definitely do that and satisfy a large checkbox on the requirements from the IRS to complete a CHNA. Stephen Jenga is from our Strategic Quality Initiative shop, and he's got a lot more experience working with, where the boots are on the ground in Missouri. Stephen, do you want to add anything?
You know what, Matt? You hit the nail on the head, because I think with the nature of the reports that we are able to derive from these, because we do get these questions from critical access hospital, and something which is always on top of their mind is what kind of secondary data sources can they be able to capture, and at what level, in alignment with the guidance set forth by the IRS as that big picture. And so, in fact, we have seen an uptick interest from hospitals and other organizations getting into the Expo More Health and deriving that data and using it to provide the needed specificity to help the implementation team, because there is the needs assessment component of it, there is the implementation piece, which is big, and knowing that every hospital in a 3-year cycle, there's a requirement for IRS to audit and see what kind of information is on there. I think this provides more enriched data, which is helping guide the hospitals to more specificity to where that if the top issue, and I'm just gonna throw chronic illness, if diabetes is the main issue and you have this data at the county level, then taking it to that zip code level guides them and helps them to have more specificity, that where they thought that one strategy can work for a county, and if there's like 10 different zip codes and they identify 3 of them, that's where the real issue is. It helps them guide their efforts based on the power of that data on in understanding what is so unique that we can be able to customize and meet these individuals where they are. So there's a whole multitude, there's uptick and interest, and I continue getting a lot of phone calls and questions about hospitals and all organizations incorporating these data to their needs assessment work. So a lot of good things.
Yeah, that's terrific. Thanks, Stephen. So yeah, I mean that's really the gist is being able to target those really scarce community health improvement resources to where they're needed most. So like the example, on the map room, the bottom of the map room's homepage, if you're a hospital in that county that has the highest rate of smoking in Tennessee, and you're wondering where to direct resources aimed at reducing rates of smoking or incidence of lung cancer, you would really want to focus on that one zip code, as opposed to spreading, that fixed pie of resources across, 10 or 20 zip codes in your service area. So I hope that was the long-winded response to a pretty straightforward question. Basically, Marilyn, to develop the CHNA, you're going to need to dig into Atlas, and you're going to end up with much more granular information than anybody outside of Missouri or Tennessee have, just because people aren't health data at the zip code level are pretty much unheard of. So you're going to end up with more meaningful, much more granular data, and you're not going to spend tens of thousands on a consultant to go in and do this for you, or hours and hours of manpower going out and mining the data and building these types of models on your own. I mean, it's just there for you in a nice little reporting platform.
Yeah, that sounds great. Certainly, having a conversation and being able to use this data to guide that, I would think would be especially helpful in a community discussion too. I hadn't really thought about that way of using it, but yeah, that's great. Thanks, Matt.
You bet.
On the different reports, the data, is it all from a specific time period, or depending upon what elements you choose, it may be different time frame?
Yeah, it depends on the source. All of the Tennessee Zip Health rankings data is from fiscal 15 through fiscal 17, and that is reflective of inpatient and ED discharges across the state during that time period. some of the census data are more up to date. Some of the county health rankings data comes from, I think, 38 or 40, plus different sources, and the periodicity just sort of varies by the indicator that you're looking at. But they provide ample documentation on this specific time periods represented by each measure on their website, and we point. We're doing some bidirectional pointing back and forth from county health rankings to here, and then from here to county health rankings. So it depends on your data source.
And you can see if you go to a report for the Health Atlas there, Sam, and expand the indicators, you can see in the little circle I for each indicator some information about that time span. So if you click on, yes, adult obesity, you can see that it is from the County Health Rankings 2017 on that. I guess it's when you actually make the report, it goes into the full information. So, yeah. But that help on dates is available in the report. I guess not. Okay. Or it will be shortly. We're still working on that, Matt. We are, as you mentioned earlier, we're going to link back and forth with county health rankings on that data.
Oh, gotcha. Okay, sounds good.
So, Sam, have you saved any reports or maps?
I haven't.
To show them what it looks like? Okay.
So I'll go ahead and just save this Atlas report here. You can enter a name. So I'm just going to do adult obesity in Anderson County. And I guess I could have put that in the description. Hit save. That way we can see what it looks like in our My Reports and Maps. Come up here in My Reports and Maps, and then here's my title and the description, the day it was created, the type of report, and then you can hit view. It'll take us right there. Right back
yeah.
to the
So you notice at the top, Sam's title for this report is included in the header, so that could be, Barnes Jewish Hospital, 2019 CHNA or whatever it would need to be. And Sam, would you mind spinning up a PDF so Mary Elaine can see and others can see what that looks like, ready to print or post to your website?
Any of these indicators map back to if there's a hospital in that county or not?
I don't think we identify hospitals anywhere.
I don't think they do either.
No, hospitals is not one of the data sets that is included in this particular tool.
Could probably add a layer, at some point, if we had the latitude and longitude coordinates of each hospitals in Tennessee. I'd like to do that in Missouri too, Chris.
Mm-hmm. We have a couple of different data sources for hospitals, but probably the CMS data set is the most complete on that. Did you see the PDF file that was there briefly?
Yeah.
Did they?
Oh, yeah. Were you able to see that PDF file I spun up? I can go back to it.
Just to show that this is a fully portable document, has all the same information that you see in the reports, plus a link back to the source and date that you retrieve this information. So this is just a one-pager, but if there's multiple,
it could get pretty long.
Indicators, it could be a lengthy report.
Yeah, if you did a zip code report for Davidson County with all of the indicators selected, that would probably be hundreds of pages.
Yes.
Mm-hmm.
Any other questions you can think of?
I don't see any here in this room.
Okay.
Your recommendation.
Stephen, Josh, Laura, any questions? Stephen, I hope you found I wasn't even aware of all of the functionality in the map room. So hopefully that is helpful to you and your work directly with hospitals.
Absolutely.
Any questions?
Absolutely. You know what?
Yeah.
It is very helpful. I always find it very helpful because I know there are some reports or areas that I typically go more than others. And so with this information, there's some additional information that I have that's going to help as we continue to work with hospitals in this space. Thank you.
Awesome. And all the same functionality is available on Explore MoHealth.
Yes. Yes, it is.
And I just wanted to point out at the bottom of every page, there is this contact if you have any questions you can't think of right now. And then a lot of things have been addressed on the frequently asked questions as well. So feel free to reach out.
Does that go to them now?
No.
Yeah, Brian,
Feel free to forward any over.
Negotiate for it to continue to go to them.
Yeah, if there are any specific CARES tools questions, feel free to, you can email us. You can either go to that's not a link. I'll go ahead and
Through
put
this is the best way because
Okay.
we also receive those.
Oh, okay. We do
not.
receive those?
Okay.
we do not.
Okay.
I'll put my email in the chat that you can note down if there are any further questions.
Yeah, we've got Mel on speed dial, Sam. Don't worry about it.
Nice. Good.
And I guess we can make recommendations for things that might need to go in the FAQs if just as we start or members start using it, if we see things that we think need more explanation.
Absolutely.
Definitely.
And again, there's the launch this Friday on the 20th, but we're treating that, my understanding, Brian, we're treating that as a kind of a soft launch, and you will start promoting this in the new year at some point, right?
Yep, that's correct.
Okay, so there's still opportunity for, rewording in the FAQs or something like that as you see need.
Do we need a password as of Friday to be able to go in?
No, Friday is when the password will come off and it'll be technically publicly accessible. But for right now, you need that password to get in.
Yes, and so after Friday, then things like a Google search will also find the site. Right now, it should not. It does not. Okay.
It does not.
Okay.
It finds the password page and then stops.
Yeah, internally here at THA, our firewall doesn't like staff going to this site because the firewall service hasn't yet indexed the site, and so it doesn't trust it. So you'll get a little warning that says, we don't know what this site is, proceed with caution, do you want to proceed? So you do have to kind of work through it. That should, once we launch, once Google and that our firewall vendor actually index the site, we should no longer have that, but just to try to access it here internally.
Pretty strict.
Yeah, that might be your firewall might not like WordPress. I think we ran into a similar issue when ours was behind WordPress password wall.
Yep.
Right.
Well, thank you all very much. Very, very helpful. Like Matt said, I've sat in on lots of debugging and testing and those sorts of things with the site, and I learned quite a bit, quite honestly, especially with the map room of some of the additional data sets. Kind of my focus has been looking at the county and zip health rankings and the alignment there, and kind of missed the fact that there are so many other national data sets, again, that go across the Tennessee border, which will be beneficial to our members as well. But thank you very much for kind of taking the time to walk us through it and kind of highlight some of the features and those sorts of things. It's been very, very beneficial. So thank you.
Yeah, I agree. And great job on building this out. I think it's going to be a great resource for our whole state that we can be very proud of. So thanks so much.
You're welcome. Well, you guys have a good rest of your day, all right? Glad we could give you 30 minutes back.
Yes, thanks for your time.
Thank you.
Yeah. Thanks all. Bye.
Thanks.
Bye-bye.